Hello everyone, this is Ashley Ramos, and today I will be presenting my Module 5, The Business Perspective on Telehealth, PowerPoint. So starting off, I have 3 topics of the 5 on this slide, specifically funding options, telehealth business plan components, and billing, reimbursements, and compliance issues. So to start off with funding options, I investigated 2 main grant programs, which grant programs in general are programs that something the federal government will do to be able to help provide funding for companies that need it or businesses that are emerging. The first one is the Telehealth Network Grant Program. A small overview of it was a funding opportunity for promoting tele-emergency services. Tele-emergency services specifically for rural areas with an emphasis on telestroke, telebehavioral health, and tele-emergency medical services. The second one is the Licensors Portability Grant Program. This was created to be able to provide support for state professional licensing boards to carry out programs under which various licensing boards from many states were able to cooperate and develop state laws and related policies that will reduce regulatory barriers in telehealth. Our second topic is telehealth business plan components, specifically with meta-analysis, and these are 3 topics within meta-analysis: target population, competitor landscape, and consideration of payment method. Target population is pretty self-explanatory. Basically, when you're planning on creating your telehealth business, you have to consider who will be your target population. Do you want to focus on behavioral health? Do you want to focus on chronic issue? Do you want to be a pediatric service? Do you want to provide service to older adults? And examples like that. Competitor landscape is also pretty self-explanatory, with telehealth being such a growing business over the past decade. You do have to consider competing against the big companies such as Teladoc, for example, which already has years of experience and has already built a good customer base. And considerations of payment methods are basically, where will you be getting your income from? Are you relying on Medicare and Medicaid? Are you relying on private insurance? Or are you relying on direct to consumer, which is just relying on direct payment from your patients? And our last topic on this slide is billing, reimbursements, and compliance issues. So basically, many pandemic flexibilities such as co-payments and covering for patients were only meant to be short-term, specifically for the pandemic. For example, Medicare coverage will expire in 2027, so if we don't come to a policy agreement soon, coverage for telehealth services coming specifically from Medicare will be gone, which is a really large form of income for these telehealth services. For our second slide, our 2 topics on this one are emerging and innovative business models and looking ahead in the future of telehealth. So one emerging business is Amazon Healthcare. So Amazon Healthcare is a convenient care through Amazon One Medical, which is primary/virtual care or telehealth services, Amazon Pharmacy, an RX Pass, and it does feature a 24/7 on-demand virtual care and in-person visits in major cities and paid per visit options. One of the reasons this might be an emerging business in the future is because Amazon is already a really huge company. So seeing them lean a bit more into medical services is pretty interesting, especially since they already have a huge funding opportunities due to being a multi-billion dollar company. And looking ahead for the future of telehealth, a big issue before was patient trust, because of frauds and scams that were on the high in 2020. Because since telehealth was still be emerging a bit during that time, there was a lot of scams going on. And financial stability, this issue is a bit iffy at the moment. There have been a lot of policies going through in order to help keep funding telehealth and keep researching on the benefits of it. But for example, as I mentioned before, Medicare will only cover co-payments until 2027. So there are those issues on where telehealth companies will keep getting that money if policymakers don't have that much trust that it'll still be convenient. And here are my resource pages. And thank you for listening. I hope you enjoyed.